Hi, this is Dr. McLaren, and I'm here at my clinic Skin Secrets, and we're going to show you the best way to do a lip plumper or a lip filler in a young person. It's totally different than somebody that say is in their 40s, 50s, 60s. So this is Meredith. She's only 31. So she already has a very young looking face. She already has very pretty lips, but her ratio's a little off. She's got a nice full pouty lower lip, which is great. But her upper lip, the borders are starting to get a little bit ragged and her ratio's off a little bit. So we're gonna mostly work on her upper lip and put a little bit of filler in the lower lip. And I'm just gonna show you how easy this is. She already had a block done. So I put a little tiny mini block in her using a Botox needle. I like to do that because my patients barely feel that when we do it. And I think just doing topical, then it's harder for some people to get through. So I prefer that, and she just had that done about 5 minutes ago. So I'm going to start with doing just her upper lip on the belly, open for me. And you see an instant result with this, and it's so pretty. The right way to do filler, if you're an experienced injectionist, is you actually do it by feel. You don't ever look at your syringe and see how much you've injected. You really know how much you're putting in. It's really a feel thing. And I can tell pretty much almost to the 0.01 cc, I can tell how much I put in with any stroke. I'm going to do her cupid's bow because she's young. She's already got a really beautiful cupid's bow, but we want to accentuate that even more because why not? At her age, it's a great thing to do. So I just did the cupid's bow, and then I'm going to do this lip border, and I'm going to do the other part from the other side. This is one of those things you do have to go back and forth across the table a little bit. And with somebody her age, I can go almost clear to the corners. If somebody's older, I really advise against that because as we age, our lips, tend to spread this way. So you don't want to take somebody in their 50s and go out further. It makes them look a little bit like a joker. So that's half of her upper lip. Now I'm going to just do the other cupid's bow here. Try to smooth out these wrinkles a little bit, and I'm going to put filler in what we call the belly, or the muscle belly of the lip. Again, you pretty much do it all by feel. And then I'm going back up here. I want to get some of her border. She is someone who can handle a border. There's many patients who have sort of a turned down border. I never put filler in those patients. It'll make them look really ducky. I would say don't be afraid of having your lips done. You just need to go to someone who does a lot of it because every patient's different in terms of how much filler you want to put in them. You can see how nice and even that already looks. But now I want to get some of these wrinkles in here. If you feel this, you tell me.
Mm-hmm.
Okay. So that's good. Okay, and open. Okay, so her top lip is really pretty much done. And then I'm going to put a little in her bottom, but I'll show you. She really should walk out of here looking pretty well, except for that lidocaine block can make her feel a little numb when she tries to talk. But if you look at her now, she has just a really pretty upper lip now. Now it's looking kind of swollen compared to her lower, and it is. The other thing she has is open for me. She has pillows. So what's so interesting about this is she has a pillow here and a pillow here. That's a very natural thing that she has. She was born with that. So I don't like to ever go across the pillows. I'm going to go straight up to that pillow line, and I'm going to create more of an accentuated pillow on each side. But I don't want to go through it because I don't want to take that away. That's just something she genetically inherited, and I think it's a very pretty look. So you can see that I won't cross that midline. I'm going to go up just to the midline because I really want to accentuate each pillow just the way they are. And so you can kind of appreciate she has a pillow on each side. and I want to keep this negative right here. So this is what I mean by the pillow. So you can see, Angelina Jolie is known for that, right? She has a line down the middle of her lip and a really pretty pillow on both sides. Let me have you relax again. Okay, and then, like I said, because she's young, I actually can do a little more right at her corners of her mouth, which I wouldn't necessarily do with a younger, an older person. I also like to get just a little bit of this, what we call the modiolus. I like to get this line to turn up a little more, even though she's fairly young. So I'm going to put a little bit of filler in there. And we're just going to do the rest of this lip. Open for me. So again, this is more at her border. And close. And again, I'm going to do just a little bit of this, what we call modiolus, to keep this kind of turned up. Okay. So, there you go. She just had this done. That's even with the block in. Open for me. And she looks really good even walking out of here. So, and how was that?
It was good. Bad? Yeah, pretty easy.
So she looks a little bit like a Kardashian lip right now, but I assure you that the swelling will go down in 2 days and it'll look more natural even than it does now. So, once again, this is Dr. Greta McLaren. Talking to you from my clinic Skin Secrets. Feel free to follow us on our Instagram and Facebook post and at skinsecrets.com. Thanks.